To know that something that you're a part of helps somebody's health, daily life. I just found out that I'm a type 2 diabetic. I really didn't know a lot about, the sensors and all that, and learning that and how I'm dependent on it and how I'm dependent on that company to produce this product so I can know that I'm healthy daily. It touches my heart. I love it.
It's funny. You think you're filming a story about manufacturing, and then someone says something like that, and the whole thing reframes itself. This is not just about medical devices. It's about the people behind them.
We're the face of the company to the customer. They're emailing us, they're asking questions. We are the feet on the ground to go get the answers for them and to provide them with the information that they're looking for in a timely manner. It's the ultimate goal to get back to them and make sure they're happy at the end of the day.
If you want to understand this place, Rachel's a pretty good place to start.
We've worked with a customer that has had some shifts in their forecast. Quite recently, they had an uptick that caused us to have to scramble a little because we wanted to make sure we could get the product to them in the time that they needed it. It was a lot of cross-functional teamwork, working with our planning team, our shipping, production, to really pull it together and get them their product. And we were very successful with that. That was at the end of last year. And we drove it home and got them their product in time.
A scramble around here isn't just a supply chain story. It's a human one.
We feel really good because we know this is getting out in the end to the client, to somebody that is needing this medical device. And that is the ultimate goal.
Rachel is one of the many faces and voices that Forj Medical customers know. But the people who keep this place running, the ones that make sure every part is right, that's where the story goes next.
It's all because of saving life, giving people another shot of life. And I feel that, working at Forj Medical, we're allowing individuals who has hardship in life to have a second chance.
He isn't exaggerating. This is how Bong actually thinks about his job.
I did started as a machine operator and worked my way up through various job titles and departments to get where I'm at today. We have the ability to do everything in-house. That's from doing a tool design to having a tool to being able to develop a process for that particular product in-house and being able to run production in-house, doing our testing, final assembly, packaging, creating a device that may very well turn somebody's life around. I want to be a part of that, whether I'm just working behind the scene or I'm actually the frontline worker that's going to get that done.
Bong has been a part of the Forj Medical team for over a decade. He's the one behind the scenes making sure that the work keeps moving. The tools, the machines, and the processes that make sure customer orders ship when they need to.
We treat our customer tool like it's ours. Our craftsmanship allows us to have a quicker turnaround time, not have any downtime. With our 3D printer, that should allow us to design and build a prototype tool. We had a tool here over a year ago. This 3D printer was actually what we used to print out the damaged area. It was probably less than a week. We were back in business, developing the process, continuing on without even noticing that we had any downtime.
With milling equipment, hand tooling expertise, and a steel 3D printer all in the same tool room, inserts and components can be rebuilt on the spot. Repairs happen in hours or days instead of weeks, which minimizes downtime and allows faster customization and adjustments without slowing production. Bong reveals the hands-on craft and pace required to keep medical molding moving. But precision at this level also depends on the systems that surround this craft. The processes, the automation, the engineering discipline behind every part. That perspective belongs to Rich.
I've had the engineering skills, the ability to find better and better ways to make things, and I like that idea, and I certainly like the way that my skills are helping people creating products that are able to extend life. In manufacturing medical devices, you're making such a bigger impact on people daily. You can see the people using these devices and how it impacts them, how it improves their lives every day. Automation is simply a way to put something together. It's a lot more accurate than a human actually assembling.
Molding is just one part of Forj Medical's end-to-end offering. From early R&D collaboration to automation engineering, full-scale production, and assembly, the team works across the entire life cycle of a micromedical device.
There's 3 different teams of engineers. One's the manufacturing engineering team, the R&D team that are creating new molds and new products. The other team is the automation team. And they're the ones that can step in at any time, whether it's during the initial designs to improve a process or take a look at our existing processes and try and come up with a more automated solution. The automation team kind of straddles both sides, R&D and manufacturing. We all work together on things.
At Forj Medical, collaboration isn't an accessory, it's the operating system. Precision comes from people who see the whole picture, who solves what breaks and share a sense of responsibility for every part that leaves this building. And that's why this work matters. Not just the tools, not just the processes, but the lives on the other end of them.
Everything we do is for that patient out there, that person that needs any type of medical device that we help develop. And my team gives 110% every day. And I can't tell you how proud I am of my team and how proud I am to be part of our team. We all work together. It comes from the support that we all feel from our leaders, our team members. We all help each other because there would not be Forj Medical if there wasn't every team member that we have